Lymphoma is a disorder of the blood which particularly affects lymph nodes, which get swollen and enlarged, and it spreads rapidly and needs to be treated often with chemotherapy. There are two main types: Hodgkin's lymphoma, which affects younger patients, and non-Hodgkin's lymphoma, which is more common but affects older patients. It's an area of unmet need because of the growing incidence and the fact that patients present often with quite late stage disease that needs personalised treatment. It's one of the main areas that we use PET-CT. It combines anatomical imaging, where you can see the different parts of the body, with functional imaging, and what it involves is patients having an injection of a mildly radioactive compound which gets incorporated and taken up by cancer cells, and then you can acquire those images and superimpose them on the anatomy image so that you can accurately localise where in the body the hotspots are. We've been supporting a range of projects, but we've actually led this particular project in collaboration with Mirada Medical and Alliance Medical around developing a prototype for AI-assisted reporting using PET-CT in patients who have lymphoma.
Lymphoma PET-CT can be very time-consuming and complex to report due to the way the disease presents on a scan. You can have a patient with a very small amount of disease or a lot more, and you also have a number of regions that look like cancer but actually is not, is physiological uptake that the clinicians need to be aware of and not report. So what we were trying to do is explore the use of artificial intelligence in order to automatize really some of the process of reporting by highlighting to the clinicians the disease.
So my role was to first identify cases that we could use, which are a selection of cases that represented normal day-to-day scenarios. But also we wanted to show that AI wouldn't negatively influence readers. So the idea was that I would select cases that if the reporter would make a mistake, that it might affect patient management, just to show how safe AI would be. The quality report stayed the same, which shows that we have, well, high quality reporters here in the UK, but we also demonstrated that increased the efficiency, so the reports were quicker when they were reporting. Also, we demonstrated that presenting false findings to them, it didn't negatively influence them significantly, so it wouldn't affect patient management.
I think what was really exciting is to see that we could already make an impact with a simple intervention like this. We're looking at Mirada progressing the technology so that it is ready for productization. And on the other hand, we're looking at expanding from lymphoma to other indications. I think AI-assisted workflows is part of the solution, but it's part of the toolbox. We really much start from the clinical problem. AI can be really useful, but to know what to solve is the first step.